Hello, good morning. My name is Julio Chavez. I'm from the Moffitt Cancer Center in Tampa, Florida. The study is called long-term follow-up of the Golcadomide plus Rituximab for patients with relapsed refractory follicular lymphoma. The rationale of the study was to test Golcadomide, which is a novel immunomodulatory drug, similar to lenalidomide, which is widely used for lymphomas, for multiple myeloma. And so mechanistically speaking, Golcadomide is much more potent. It's kind of like 100% inhibition of the target. So as opposed to lenalidomide, it has like a maybe 20-25%. So there was a rationale to use this in lymphomas. And there was a pretty refractory patient population, median lines of 4. Many patients had prior CAR T-cell therapy. Patients had bispecific antibody. So basically no really true treatment options available for these patients. And we had high response rates, almost like kind of like a bispecific antibodies, like overall response rate close to 80%, CR rates of 60%. The PFS, the progression-free survival is still mature, but patients who had achieved complete response, they still have maintained response. So it's a little longer follow-up, but for follicular lymphoma, we need a little bit more longer follow-up to find out whether there is actually durable responses. But at least the preliminary efficacy in terms of complete responses is remarkable. Why is this study important? Because it offers an outpatient option. Now follicular lymphoma is being filled up with bispecific antibodies. We have 2 bispecific antibodies approved. We have 3 CAR T-cell therapies approved, but they're still kind of limited to academic centers or bigger hospitals in the community. That they still trying to figure out how to get these patients into the community. So this is a fully outpatient, it's oral drug. In terms of toxicities, majority of toxicities were related to neutropenia, hematologic toxicity that was very well manageable with growth factors by the doctors. So I think I'm fine valuable this study because how feasible it is to do as an outpatient.